And I want to turn now to another big decision from the federal government today. Canada's busiest airports are dealing with extraordinary delays, and travelers' frustrations could grow. Despite warnings flight delays could last until Christmas, the federal government is extending COVID measures at the border by another month.
The federal government has at its hands the root cause and the cure to the wait times, which is removing random testing and duplicative health screening questions from Canada's airports.
Here to respond, Omar Alghabra, the Minister of Transport. He's in Ottawa. Hi, Minister. Good to have you back on the program.
Hi, Vashi. It's good to be back with you.
I do appreciate you making the time. Your government announced, as we just recapped there today, that it will extend measures at the border for another month. What is the specific criteria for lifting those measures?
Vashi, everything we've been doing at the border has been guided by our intent and our desire to protect the health and safety of Canadians and those who work in the aviation and tourism sector. And just like many other jurisdictions around the world, we find that some of these public health measures act to protect people, to protect citizens, but also to act as an early warning, as we've seen in the past, how sometimes we've been hit by a variant wave that gets imported from outside. So these measures are continually guided by our experts' advice, and it's intended to protect the health and safety of Canadians.
I just want to make sure I understand, because I do remember a time when your government was saying actually the criticism that you should do more at the border was unfounded in science, was not founded in science. There is community spread of COVID, and there has been for a number of months. What exactly are you preventing by putting up these restrictions at the border?
First of all, Avashi, it's important to note that many of the border measures have been lifted. The pre-departure test has been lifted. All of it, it's whether it's a PCR test or antigen test. The at the airport or upon arrival test has been lifted. Now, the only tests we have, or the restrictions or the conditions that we have, are making sure that arrivals are vaccinated. Second, we have a random testing. So we sample some of the arrivals and ask them to get tested just to keep an eye on variants and the type of importation of virus that we get. And what is proven to us in the past is that these type of measures have delayed, yes, of course, the virus and the variants ended up arriving, but it had delayed the peaks, gave Canada and Canadians and public health experts and across the entire country more time to react and respond to these early warning systems. So these measures are grounded in science, and they're meant to protect the health and safety of Canadians. We're constantly assessing those, just like we've done in the past. We've lifted some, we've reassessed others, and we will continue to do so.
So I just, again, want to be clear. You're saying that you have evidence that the measures you've put in place at the border delayed the waves of COVID in this country?
I think, Vashi, you look at the past, for example, the Omicron wave, you could see where it peaked in other countries a few weeks earlier than it did in Canada. So it is proven through historic anecdotes that our early warning systems that we have at our borders have protected Canadians and given us more time to react accordingly.
Okay, I just want to say historical anecdotes is a little different than, a full-scale provision of evidence. But at the same time, I just want to, I also want to ask you about the effect that it's having on the ground, because we are hearing from airlines and from airports that are saying it's specifically the random testing is slowing things down for international passengers. They say that it takes 2 to 4 times as long to process those international passengers. I know that you've said you're working on solutions to help with the delays that passengers are experiencing. I remember you saying, I think it was about a month ago, okay, it's not going to be solved in the next few weeks. When do you anticipate passengers can expect a quote unquote normal wait time at the airport?
Vashi, first, let me affirm the fact that our government wants to see an efficient airports, an efficient experience for travelers, and make sure that we have as smooth of travel experience as possible. And we are working with all stakeholders, with airports, with airlines, with CBSA, with the CATSA, with public health, on addressing these issues. And I think it would be, though, inaccurate, though, to reduce the entire cause for these delays or waiting times that we're witnessing to public health measures, because we're seeing waiting times for other type of procedures that has nothing to do with public health. For example, CATSA waiting time. And that's why we're adding resources. That's why we've invested in hiring more CATSA employees. We've added 400 employees. We're also adjusting some of our public health measures. For example, we announced that international travelers who are transiting will no longer be eligible for random testing to ensure that they are not delayed when they arrive to take their connection flights. So we're doing all kinds of measures. And I can tell you that the data that I'm seeing on a regular basis tells me that we've peaked. Now we're seeing wait time is being cut significantly, particularly at CATSA, and I know equally at CBSA. That doesn't mean that our work has to stop. In fact, there's still a lot of work to be done, and I support all of the stakeholders who are saying we need to do everything we can to address these waiting times. But it's really important. If we want to address these waiting times, we have to understand the root causes and learn from other jurisdictions, which we're seeing everywhere around the world.
Yeah, and certainly I take your point that it's not solely attributable to, for example, the random testing. The example I provided was from the Airlines Council, which I believe said, you know, in the processing of international passengers, you can say that alone has attributed to a 2 to 4 time longer processing time. But yeah, there's a whole lot of other stuff going on as well. At the same time, what you haven't answered yet is at which point you decide to lift those. Is it when COVID is totally gone, when it no longer exists, when there's only X number of cases? Like, I understand what you're saying about early warning. I understand what you're saying about, I think that, you know, your government wants to protect the health of Canadians and the health of people who work there. But for a lot of people whose jobs depend on that or who are traveling and experiencing this, they have no clear idea from your government about when that will change. You have not set out any metric publicly. Can you do that this evening?
Vashi, I think you've been interviewing me for over a year about these issues, and every time you've been asking me the same question. And believe me, I understand why there's desire to have some certainty. But the one thing that COVID has taught us is that we need to be prepared for the unexpected. And I think it would be irresponsible of me to give you specific that we need to keep in mind that there are risk assessments that are qualitative other than the quantitative indices or indicators that we're looking at. So look, we are always assessing a variety of factors, including risk factors, including other information that is available to base our decisions on. And while I know all of us would love to have certainty, but we are still in the middle of a pandemic. And all I can tell you, the certainty that I have for you is that we're going to continue to do everything we can to protect the health and safety of Canadians. And we're going to assess the evolving situation as it changes. And we're going to lift measures and adjust measures as circumstances changes, as we have proven in the past, Vashi.
And certainly, look, I'm asking the question because the government has yet to provide an answer, right? I take your point that it's not all about numbers, that there's other stuff going on. But in effect, you're just asking Canadians to simply trust you when they look around the world and they see dozens and dozens of countries doing the opposite, right? Lifting a lot of these requirements. And I do want to, just before I let you go, ask you about one other one. And that is not where international travelers are concerned, but domestic ones. And the vaccine mandate that is in place for people who are traveling domestically. What is your justification, your government's justification for keeping that in place?
Vashi, look, many jurisdictions around the world or in Canada at home with different provinces continue to have vaccine mandates. I just traveled to Germany. I just traveled to the United States, and both countries had a vaccine mandate at their borders. So the vaccine is proven to.
I understand at the border. I'm just asking domestically. I completely understand for the border. Yeah.
Vashi, it's all guided by our desire to protect the health and safety of Canadians. Obviously, these measures will always be reassessed and assessed, and we are constantly having discussions with our experts about when is the right time to adjust this measure or that measure. The same applies for domestic travel. These measures are, again, done to protect the health and safety of Canadians, just like mask wearing as well on airplanes, on trains. These are done to protect the health and safety of Canadians. There will be a time when these measures will be adjusted or lifted, but we want to always err on the side of safety, Avashi, and I think Canadians expect the responsible government to do so.
With respect, Minister, though, when it comes to the effectiveness of vaccines, there are a couple of things to consider. When you brought in this mandate, for example, we as a society thought that these vaccines, a double dose of them, would do a lot to curb transmission. We now know that that isn't the case, especially where Omicron is concerned. I want to be unequivocal. They do prevent hospitalization. They do prevent serious illness and death. All of that is true. But they don't curb transmission to the degree that your government and much of Canadian society thought that they would months ago. Does that not merit you taking a second look? And if, in fact, your government is following the science here, if we're talking about keeping people out of the hospital, that's actually 3 doses when it comes to Omicron. But your definition of fully vaccinated is just 2.
So, Vashi, you're asking questions that we're regularly examining at the cabinet table. My colleague, Minister Duclos, the Minister of Health, he's constantly listening to the experts that he's receiving. And we are taking all these new information and in reality
this isn't
into
new.
account.
Respectfully, Minister, I'm sorry to interrupt, but this isn't new information. There are 3 million Canadians right now who can't travel to go to a funeral of a loved one because of this mandate. I understand the effectiveness of them. I am no way taking away from that. But 3 doses of the vaccine is actually what's effective in preventing hospitalization against Omicron. And the vaccine is not curbing transmission to the degree that your government thought it would. Why is the mandate still there?
Vashi, what is clear, and I said to you, and look, I understand there are Canadians who are unable to travel, and I take no joy in imposing public health measures along with other measures that we have. The intention here is to protect everyone's health and safety. And I understand there are things that we always need to consider. And as I'm saying, we are erring on the side of public health, and these informations are constantly assessed, they're constantly evaluated. And we've demonstrated in the past, Vashi, that we have lifted measures when we feel that it's the right thing to do. So these assessments are ongoing. And believe me, I always want to do what our government always wants to do, the best for Canadians. And that's what we're aiming to do to protect the health and safety of everyone.
Okay, Minister, I've taken a lot of your time. I do appreciate it. Thank you very much.
Thank you, Vashi.
Omar Alghabra is the Minister of Transport. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.